Man, Issa Briones has an awesome voice. Season 2 of The Pitt recently ended, and the TV show is absolutely killing it in award ceremonies, including receiving multiple Emmys and Golden Globes. It's touted as the most accurate and realistic medical TV drama of all time. I'm a board-certified ER doctor in the USA and Canada and a clinical assistant professor at the University of British Columbia's medical school, and I've been watching and reviewing the show, and I'm going to offer my honest thoughts and reflections on Season 2 of The Pitt. I'll start with the 3 best and the 3 worst cases of the season, and then I'll rate the show on a scale of 0 to 10 for medical realism, storytelling and character development, impact on society, and then I'll finish with my overall impression and final verdict. If you haven't watched the show yet, there are spoilers ahead, and I would encourage you to watch the show and my reaction videos to each of the episodes before watching this video. Okay, so let's start with the 3 best cases, which essentially are the ones that left the biggest impression on me as a viewer. Starting with number 3, Orlando, who had diabetic ketoacidosis and couldn't afford care.
But can you stay for at least 12 hours? It would get you out of the danger zone.
No.
So she's doing a really good job trying to advocate for the patient and convince him to stay. You know, if I were that physician and this guy decided to leave, I just don't know how I would sleep at night. Like knowing that this guy's probably going to get more and more sick and possibly die for something that's completely preventable as well. That would just eat away at your conscience. It illustrated how healthcare affordability impacts care and outcomes for patients.
One of the biggest problems in healthcare right now is that a lot of people don't have access to a family doctor or a specialist to manage their health concerns. And what that means is they end up going to urgent care or the emergency room, waiting for hours in a crowded waiting room surrounded by people who are coughing, vomiting, or really sick for something that could have been handled much more easily in a clinic or over a video call. And that's where ZocDoc comes in, who sponsored this video. ZocDoc makes it way easier to find and book a doctor. You can search for local in-network providers, compare options, read real patient reviews, and see detailed profiles all in one place. They've got over 150,000 providers across 200 specialties, and you can actually see real-time availability and instantly book an appointment. Most visits happen within 24 to 72 hours and sometimes even the same day. And the best part is that it's completely free to use. If you've been putting off a health concern, this is a really easy way to take that first step and deal with it early before it turns into something that lands you in the ER. Head to ZocDoc.com/Dr. Jeff or click the link in the description to get started and book your appointment today.
Number 2, Roxy, who had end-stage malignancy and broke her ankle.
You make it very sleepy.
Damn.
I'll go be with the boys.
This case highlighted compassionate care during end of life, and the many facets of the case really resonated with me. The way that she ultimately died a peaceful death in a dark, peaceful room in the ER with her husband and Dr. Robbie, while McKay got completely sidelined by another patient outside of the hospital, I thought was kind of anticlimactic, but kind of perfect at the same time. Number 1 on this list might actually come as a surprise to many of you who watched the show, but it was actually Ogilvy's patient who came in with what he thought was a kidney stone and was later on found to have a ruptured AAA or an abdominal aortic aneurysm. And this led to the patient dying in the operating room and Ogilvy completely crashing out and realizing that he isn't fit for the job.
You having some pain again, Mr. Green? Mr. Green?
This one's yours?
Yeah, he was just waiting on his discharge meds, pain-free.
You okay, man?
Damn. That gave me shivers. I got goosebumps, man. I don't know if you can see this, but yeah. Good job on the actor who plays Ogilvy, because I feel like that look on his face is something that I've seen a few times in my career, and you can just feel when someone is just riddled with guilt.
And it also highlighted how missing a diagnosis and having a bad patient outcome can permanently scar a healthcare worker and shake their confidence. This case gave me visible goosebumps, and I was really surprised at how choked I got seeing Ogilvy crash out over this misdiagnosis. The 3 worst, or WTF, cases that made me crash out the hardest during the season were number 3, bloodletting used as the treatment for congestive heart failure in episode 12.
One donor bag, 500 cc's, no more.
Please don't tell me they're gonna bloodlet this guy.
Okay, let it
It's
out.
crazy. Okay, what they're saying is that because the guy is so fluid overloaded, they're actually gonna just bloodlet the patient, essentially insert an IV and just let all the blood drip into a bucket or drip onto the floor to get some of the fluid out of his system.
This is not something that we would ever do in a developed country. Number two is the nasotracheal intubation that was performed on the patient with severe obesity just because he needed to lie down for a CT scan.
Okay, so Abbott is pushing the endotracheal tube into his nose. I don't know what is going on. What is going on?
Again, I don't think that this was realistic, and most ER providers would go for a standard intubation in someone with severe obesity because of the higher pressures caused by the weight of the chest tissues. And the number one WTF case that you probably knew was coming was Langdon performing the reduction of the cervical bilateral facet dislocation.
Started to tickle. I felt something click.
Langdon just reduced the unifacet cervical dislocation.
What?
Bro, what? Okay, that is so unrealistic. I don't know any emergency physician anywhere in the world that would actually do something like that.
This was by far the most unrealistic thing that was portrayed in season 2 of The Pitt. And there's almost no reality in which this would ever occur in an urban or academic ER. If a resident or a doctor did something like this in real life and it didn't go perfectly well, they would be sued, and they would be sued successfully for that matter. On that note, let's talk about the overall medical realism of The Pitt. Resuscitations were really accurately demonstrated, like the pace and the chaos, the teamwork and communication, and even the discussions and disagreements between doctors when a patient was sick and dying in front of them. The medication choices and doses actually do reflect the ones that we use in real life, and the decision-making with uncertainty and how the team changes their plans as more information becomes available is also a reflection of the reality that ER doctors have to deal with every single day on the job. The systems were also a reflection of our reality, like dealing with bed blocking, long ER wait times, integration of technology like AI scribes, and also what happens when technologies fail, like with the IT outage. Procedures were incredibly realistic in how they were demonstrated. For example, the thoracotomy that was demonstrated in episode 1, all the way to the delivery of the baby and placenta in the final episode. But one of the things that rubbed me the wrong way a few times was the context in which these procedures were being performed. Doing a perimortem C-section in the ER without an OBGYN or a neonatology team in the room would almost never happen in real life in an urban center. But while these examples are quite nuanced and very specific, they do get a lot correct in terms of what actually happens in a high-volume urban academic ER. For medical realism, I would rate the show 9 out of 10. And I would actually say that out of all the medical shows that I've ever watched, this is 100% the most realistic of them all. The fact that I could use this TV show as a substrate for medical education speaks to how realistic the show actually is. Like, I probably wouldn't be able to do these kinds of reviews with medical teaching and explanations on a TV show like House MD, because first of all, I'd be swearing every 5 minutes out of frustration. And second of all, it's just such a far cry from reality that the gap is just too wide to fill. There are obviously a lot of different characters that were featured in season 2, but I'll talk about just 3 characters and their development throughout the season. First of all, Dr. Al-Hashimi. She's introduced in episode 1 as kind of an uptight persona who seems to have really idealistic ideas of how the Pitt should be run. And this is directly in contrast to the main protagonist, who is Dr. Robbie, who is obviously very well seasoned, often rolls with the punches, and is kind of fixed in his own ways. But her character really grows on you throughout the season through her empathy for Langdon as he's getting back on his feet, and the way that she advocates for the guy who came in with a mandibular fracture and malnourishment from jail, and how she was trying to push Dr. Robbie to admit the patient. And then as the season progresses and you find out that she has a seizure disorder and she has a huge argument with Dr. Robbie and has a breakdown in her car, you feel so sorry for her because you know that she really prides herself on her ability to care for her patients, but she's no longer able to do that through no fault of her own. The next character that I want to talk about are Santos and Langdon. And this is kind of a 2-for-1. I'm lumping these two characters together because their character arcs are so closely tied together throughout the season, and they often contrast each other, and they actually represent the spectrum of real personalities that exist within the emergency medicine world. So Langdon is the empathetic doctor who is trusted amongst his colleagues to take care of their loved ones. Like when Mel's sister comes into the ER, she wants Langdon to take care of her. But his sensitivity also clouds his judgment during the necrotizing fasciitis case, where he's so caught up in the drama between him and Dr. Robbie that he spends so much time underplaying the patient's symptoms to defend his own ego. And this leads to a delayed diagnosis of necrotizing fasciitis and an above-knee amputation of his patient. And Santos is the flip side of that coin. She's really insensitive with her patients and her colleagues. And on one hand, this personality trait of hers allows her to make decisions that are based on best practices and guidelines and stand up for herself, even when her superiors disagree. For example, the patient who had a large hemopneumothorax or blood in the chest, she was absolutely correct in that the patient needed a surgical chest tube, and she stood her ground when Langdon and Dr. Hashimi incorrectly advocated for a Thoravent, which is essentially just a needle with a valve that drains the air but does absolutely nothing for the large collection of blood inside the chest.
In traumatic pneumothorax, we should prep the chest.
Not necessarily. He's hemodynamically stable.
I think Langdon is pushing towards more of like a pigtail catheter, which should never ever be done in the setting of a traumatic pneumothorax or a hemothorax because it's a smaller diameter tube and it will be clogged by blood and will stop working almost immediately.
I can put in a chest tube.
He doesn't need a chest tube.
What? Bro,
Okay, what do you want, a pigtail catheter?
I was thinking a Thoravent.
What? Why?
It's not a bad idea. No need for well suction.
If Hannah can operate today, he can go home tomorrow with a Thoravent.
You can learn a lot from your senior residents.
And that case also demonstrates how medical hierarchies operate, in that the voice of the people higher in the hierarchy have a more valuable opinion, even if they're wrong.
This same personality trait of hers leads her to dismissing a patient with chest pain early in the season, and later it was found by Whittaker that the patient had a missed posterior STEMI. And when Whittaker approaches her and tells her about the diagnosis, she kind of shrugs it off and, gets defensive about it. And the last character that I want to discuss is Dr. Robbie. Obviously, he's the main protagonist of the show, and I loved how they portrayed him as a very multidimensional character. So while he's incredibly supportive of his learners, they also show how his expectations of his learners also lead him to, doing things like embarrassing Mohan in front of her peers when she's crashing out and having a panic attack, and how he pressures Javadi to perform that EVD and pressures Langdon to perform the cervical neck reduction when it's clearly outside of their comfort zone, and this puts his learners at risk in the process. Dr. Robbie is at the center of some of the biggest ethical dilemmas of this season, like navigating the situation with ICE and deciding whether he'll prevent Dr. Al-Hashimi from continuing to work in the ER. And his character has a really strong moral compass, and despite all of his flaws, he uses his moral compass to guide his decisions, which I believe were the correct calls. Burnout and mental health care issues among healthcare workers is a major theme in this season, and Dr. Robbie's suicidality is central to this narrative. He says in the final episode that the most important things that he's ever done has been inside the ER, and he never married, he never had any kids, and he likely sacrificed his entire personal life for his medical life. This is a pretty common and relatable situation that I've seen amongst the doctors that I've met throughout my career. And I think the most common way that this existential crisis manifests is through placing a disproportionate amount of value in achievements like research publications or titles in the medical hierarchy, or in money and materialism, like what kind of house they live in or what kind of car they drive. I don't think that any of these things are inherently bad on their own, but when someone places too much of their own self-worth in these things, I think it also changes their worldview and their perspectives and makes them believe that people who aren't driving a Porsche or a Lambo or working up the ranks of the hospital or publishing in prestigious journals like JAMA or New England Journal of Medicine are somehow beneath them. And to me, that's a pretty sad and empty way to view the world and complex human beings that are obviously coming from varying levels of privilege. But I think that It's probably a coping mechanism for the same mental struggles that Dr. Robbie is dealing with. They just manifest in different ways. Before I score character development as a whole, here are some rapid fire impressions on some of the characters. The person that I would trust to take care of my family members would be McKay. The person that I would not want to take care of my family members would be Santos. The person that I would want to have as a co-resident would be Whittaker. And the person that I most identify with in the TV show is Dr. Robbie. Comment below who you would choose. When it comes to character development, I would give it a rating of 9 out of 10. Next is impact on society. The first point that I want to make on this is how this show helps the general public understand what actually happens in the ER. And I think this show does a fantastic job of creating transparency and understanding of how healthcare is delivered in real time. This show almost acts as a mirror for societal issues that are currently in play. The most notable example of this was in episode 11 when ICE agents come into the ER. Just their presence causes patients and staff to leave out of fear of being detained. And whether you're pro-ICE or anti-ICE, this does reflect the reality in the USA. And I thought it was a powerful way to illustrate how government policies tangibly impact patient care and people's overall sense of safety when they come to the hospital. Another notable example was the case of Orlando. He couldn't afford being admitted to hospital for treatment, and he left against medical advice and later either jumped or fell from height, leading to a traumatic brain injury that will impair him for the rest of his life. I thought this was a powerful illustration of one of the biggest inequalities in the USA, which by most metrics is one of the most developed and most powerful nations on earth. But I just find that it's ironic that a huge proportion of its citizens aren't able to access care. This case opens up discussion on whether healthcare is a fundamental right that should be accessible to all, or if it's a privilege that should be reserved for those who can pay. I think this show is not only entertaining and gripping because of its storytelling, but the fact that it's able to illustrate how complex macroeconomic and political factors play out on an individual level just in the care that they'll receive in an ER in Pittsburgh is incredibly powerful and unique. So for impact on society, I would rate this TV show 10 out of 10. So to end with my overall impression, if I'm being honest, this was a really tough show for me to watch and review as a full-time practicing ER doctor, because it just hits so close to home. I was reviewing and recording my reactions to the TV show in between shifts in the ER, and while I was watching the show, I would often feel like I had never left the hospital. As an ER doctor, I finally think that there's a show that actually depicts what I do in the ER, and it helps the general public actually understand the challenges that healthcare workers face every single day on the job. I would totally recommend the show to both medical and non-medical people, not just for the entertainment value, but because of the deeper societal discussions presented in the show. And my final verdict and overall rating for the Pitt season 2 is 9 out of 10. If you've been following me throughout season 2, thank you so much for the love and support. The channel has honestly grown so much because of your support. And I also learned in the comments on my last review of the finale that there is an after credit scene. So let's watch it now.
Man, Issa Briones has an awesome voice. All right, I'll see you guys in the next one.